wasn't there. It was a guy. Yeah, it was sad.
Cream or no cream or half?
No cream, just decaf. I'm gonna do a fast till tomorrow at 3:29. Get my day in, you know.
I had some pita in for dinner.
Ooh, what'd you get from there?
The chicken shawarma.
Oh, nice. Okay, so it looks like it's just Jackie, but that's okay because we're gonna post this on our YouTube page. Dan, I don't see you.
Hello.
There he is. Hello to who's watching this now or who's watching it at a later time. It is 6 p.m. Thursday, April 1st. We'll get started. You ready, Dan?
I'm ready.
Okay, so let me go ahead and share my screen. Dan, is it working?
Yeah, I could see it.
Okay. Okay, so today we're going to be talking about lower back pain, all too common of a injury. I am Kenny. I graduated from Rosalind Franklin University in 2018. And Dan, I'll let you introduce yourself.
And I'm Dan, and I graduated from Western Kentucky University in 2017.
Yeah, so we're from Experience Physical Therapy. We just opened. It's a one-on-one orthopedic physical therapy practice in Buffalo Grove, Illinois. It's just Dan and I working here, so we're more than happy to be here, and hopefully we could be treating some of you guys in the future. So let's get started. Dan, you want to take it away?
So just a quick overview of low back pain. It's very, very common. Just some numbers to throw out there. About in the last 3 months, 25% of adults have reported having low back pain, and about 84% of people will have low back pain at some point in their lives. It can be described as just pain or stiffness, typically in your lower back region and the lumbar spine, as you can kind of see in the picture here, in that red area. Different time frames to categorize pain. So low back pain lasting less than 6 weeks is acute. Subacute is between 6 and 3 weeks. And if pain lasting longer than 3 months, it's chronic. There's a number of risk factors that are common in low back pain. So age, typically older age, is at higher risk for low back pain. Smokers, having muscle weakness, stress and anxiety. If you're having a lot of stress and anxiety, that typically any kind of pain, it can definitely have a greater effect on that. And then work-related factors, if a lot of heavy lifting, repetitive lifting, bending and twisting, that puts you at more at risk for low back pain. And then also weight, typically overweight and obese are more common to have low back pain. And then as well as having a sedentary lifestyle, just not being active, prolonged sitting is a big issue, and that definitely can lead to low back pain.
Excellent. Okay, a little bit more about the anatomy of the lumbar spine. The lower back is called the lumbar spine, if you didn't know. So there are 5 vertebrae, L1 through L5, and between each of those vertebrae, there is a disc. And the disc basically just helps with shock absorption and fluid movement. There's also facet joints. So there's the facet joints, and then there's the joints just between each of the 5 vertebrae. So there's a lot of joints there. And the purpose of that is just to allow diversity of movement, side bending, twisting, bending forward, flexing, bending backwards, extending. The lumbar spine is a pretty mobile and diverse joint or joints. There's also nerves that travel outside of those holes or foramen in the lumbar spine, and they innervate all the way from your thighs all the way down to your feet. And then there's a plethora of muscles that just create movement and stability in the area as well. We're not going to dive crazy deep into anatomy today. This is not what it's about. But as you can see here, there are a number of muscles in the spine, around the spine, all the way up, all the way down. If any of those are affected, that could lead to back pain. And then on the right there, you could see So that's L4, L5, S1 is your sacrum. So that area, if you're going to have radiating symptoms like pain down your leg, that's a common area where you see impingement. Dan, have you had radiating pain before?
I have. It was from like weightlifting when I was younger in college, and I had pain going down my buttock, but good thing it went away.
I luckily have never had it, but it can be, or as I hear, very debilitating. Dan, how about some common causes of back pain?
So probably the most common cause is a strain. So just overstretching muscle or tendon that can cause some micro tears, inflammation. So that can lead to pain and stiffness in the back. Osteoarthritis, typically over time in older adults. Between the facet joints, cartilage wears down or some wear and tear. So that can cause stiffness and pain. Degenerative disc disease also more age related. So as with time, discs kind of wear down. So the space between each vertebra. So the disc, as you see in the picture before with anatomy, there's discs between each vertebra, and over time it kind of grows smaller. It wears down. You can get bony spurs that form, and that also can cause a lot of stiffness and pain. Also can lead to spinal stenosis, so narrowing of space between where the nerves run through. So that can lead to pinching a nerve. So that can lead to radiating pain, numbness, tingling. Also with herniated disc. So trauma or damage to the disc, it can actually cause, there's fluid in the disc, so it can cause fluid to leak out. And a lot of times that fluid will travel within a space where the nerve runs through, and it'll really irritate the nerve on that. And that will also lead to radicular symptoms, usually pain, numbness, tingling down the leg. And then spondylolisthesis. So that's where one vertebra, it might slip forward or back over the vertebra that it's on top of. Typically, this is seen in younger adults, so like a gymnast or football player. A lot of times it can be from overuse or from trauma.
And then Dan,
Yeah.
can you hear me? Let me see here. So yeah, that's very common. What Dan was just talking about, that L5 S1
Mhm.
area. Can you see where I'm pointing here? Or can you see my mouse or no?
I could see it.
No, right?
Yeah, usually.
Yeah. So what Dan is talking about, that spondylolisthesis, it's that very common spot is that L5 on
Yep.
S1, that really lower back. Sorry, Dan.
And then osteoporosis, so it's just weaker bone, decreased bone density, um, more common in females, also more common in older adults. And then as if bones are weak, you're more prone to fractures. Obviously, having a fracture in your bone in your back will cause back pain. And then scoliosis, so that's a curvature in the spine. That normally is idiopathic. So it happens to a lot of younger kids, adolescents, as they grow through a growth spurt. Really don't know why, but their spine grows where it curves to one side. It can also go up their back. It can rotate. Sometimes in older adults, they might have some mild scoliosis that can be caused by, degenerative disc disease, posture, muscle imbalances, the last bullet point too. So just how your posture sitting all day and you're not moving around. Kenny, we've talked about what's the best posture. So
Oh, the
yeah,
best posture is a changing
yep.
posture. Best posture is a changing posture. We'll talk a little bit more about that soon. Some other overlooked causes. There's the old story of the man who broke his toe and he started getting headaches maybe a couple days later. So basically the moral of the story is, if your toes aren't moving properly, that could cause your ankle to compensate. And then that could cause your knee to compensate. And then the hip, lower back, middle back, upper back, neck, head. It seems exaggerated, but we see it all the time. So you really got to look at the foot, the ankle, the knee, the hip, Diet is big too. I'm a big offender of this. People who know me know I like to cheat a lot with diet. Whenever I notice I'm getting a lot of sugar in my diet, I start to get back pain. When I start to clean up my diet or do a little bit of fasting, it really, really helps with my pain. Sleep is big as well. Make sure you're getting that 7 to 9 hours. And pain perception. I'm going to talk about this soon. But how are you perceiving the pain? Are you perceiving it at all in a negative way? If you perceive pain in a negative way, your pain levels are naturally going to go up rather than just noticing the pain. Easier said than done, though. I fully acknowledge that.
And common symptoms, so obviously pain, stiffness, inability to move, different directions, turning, bending backwards or forward. And that can lead to making it difficult to get to a lower level, like squatting down to get in a chair or getting in and out of the car may be difficult, in and out of bed. And also when there's a nerve that may be involved, like a nerve that's getting pinched, you can get symptoms of numbness, tingling, weakness, even bowel and bladder loss of control. And that can go typically down all the way to your toes with numbness, tingling, weakness, and pain.
So we're talking about low back pain, right? What is pain? Let's talk a little bit about pain. Okay, this may be a review for everyone. I'm expecting all of you to know this already. We got your non-noxious mechanical stimulus from the A beta fibers, of course. You got your noxious mechanical stimuli from your A delta fibers. You can't forget about the slow-moving C fibers, which are noxious stimuli like chemicals and heat. Those go to the dorsal root ganglion with the projection neurons. But we all know this, right? Maybe not. If you're a little bit confused right now, don't worry. We're not going to go deep into pain science. I'm really going to just tell you a story to help you understand pain. And when Dan and I heard this story, it really kind of changed the way we look at pain. So it's from a professor in Australia, Professor Lorimer Moseley. He is a pain researcher in the University of South Australia. He gave a great TED Talk talking about pain. And he has a charming Australian accent. I do not. I will try to do my best with the storytelling, though. So he tells of a story. He was in Australia with some friends walking in the bush. Beautiful day, sky's blue, sun shining, and he felt a little stab in his foot. So he looked down, didn't see anything. He figured, it was probably just a twig or a stick or something. He said, "What the heck?" And he moved on. Except he woke up a few hours later in a hospital. He had fully blacked out and he woke up in a hospital. So what the heck happened here, right? So Professor Moseley was actually bitten by a poisonous snake. Thank God, Professor Moseley survived the incident and was healthy enough to tell the tale. Several months later, however, he was out in the bush again. Another beautiful day. Sky was blue, sun was shining, plants are growing. And then all of a sudden, he felt this excruciating pain in his foot. I mean, I'm talking 10 out of 10 pain. Take me to the ER. Get me out of this pain. Give me an anesthetic. Put me out because I cannot take this pain. So he looked down at his foot, expecting to see that scary looking snake looking back up at him. But no, this time instead, he found a little stick, a little needle, if you will, sticking into his foot. So what the heck is going on here, you may ask, what I'm asking. How is it possible that Professor Moseley experienced virtually zero pain when he was bitten by a deadly snake, yet experienced an agonizing 10 out of 10 pain when he walked into a twig? Well, the answer is quite simple. Pain is driven by perception all the time. Doesn't matter if it's radiating pain, if it is muscular pain, if it's a headache. And lower back pain really isn't different. And the important thing to remember is pain is always real too. We're not saying that pain is in your head, but pain is always driven by perception. It always is. So Dan, do you want to talk about a little bit of treatment here?
So most common treatment would be medication. So if you're having pain, you go see the doctor. He'll likely prescribe you possibly some pain medications, maybe some muscle relaxers, and then hopefully they'll prescribe you physical therapy. That will be the third point I'll touch on. But a lot of people also will try to manage it at home with some self-care, ice, heat, just resting, maybe doing meditation as well. But then physical therapy, that's where we come in. So we provide manual therapy. So Kenny and I both like doing manual therapy. So it's a lot of hands-on techniques, working on mobilizing joints, doing some soft tissue massage work, trying to decrease pain, improve motion, and then patient-specific exercise. So giving each patient exercises that will fit them and help with their issues and improve their function. And then a lot of patient education, like Kenny was going over pain science. We discussed pain, how to manage things at home, at work, ergonomics, pretty much everything that plays a role in everyday life, and hopefully prevent low back pain from coming in the future as well. And then medical procedures. So let's say pain isn't improving, it's not getting better with therapy and medication. A doctor may suggest getting an injection, usually like a steroid injection in the spine or epidural also. Another form of treatment is seeing a dietitian. So like Kenny was talking about earlier, for him, there's certain foods that may cause more inflammation and foods that decrease inflammation. And then also just maybe weight loss might be recommended by a healthcare provider. Losing weight over time can help decrease episodes of low back pain. The last bullet point all the way at the bottom would be surgery. That's the last resort. Nothing, everything that's been tried hasn't really worked. So hopefully, in most cases, surgery is not needed, but that is the last resort.
Yep. Try everything you can before, especially physical therapy. Okay, let's see. So prevention is very similar to treatment, obviously. Exercise, strengthening and stretching, proper lifting and body mechanics, avoiding prolonged sitting, as Dan talked about. Everyone watching, what is the best posture? Dan, help them out.
Best posture is a moving or changing posture. Just get up and move around.
Yes, yes. Even if I stand up straight with my shoulders back, with my chin tucked, if I do that all day, that's no good either. That's going to cause pain too. Weight management, as Dan talked about, diet, getting that sugar out of your diet or added sugar, and meditation, working on mindfulness meditation, working on focusing on the present rather than dwelling on the past or the future can help with pain as well. But physical therapy, you rarely see people go to physical therapy as a preventative measure, which is unfortunate. A lot of times people go to PT because they were injured, right? They have pain, they just got surgery. So now let's go to PT. But more and more, we're kind of seeing what's, okay, so prehab is an example. People go to therapy before a surgery or maybe even to prevent a surgery, but still they have pain. That's why they're going to therapy. We would like to see more of, you're a young, healthy person. Go see your local physical therapist for even 1 to 2 visits, just to learn a couple things about how to prevent issues like lower back pain in the future, using it more as a preventative strategy rather than reactive. So everyone has homework to do. Dan and I could give you 1,000 exercises for back pain that would take hours to go through. So we just decided to give you something that is pretty easy to do over Zoom and to explain. And there's a nice visual here. So what these are called are pelvic tilts. All you need to do is lay down on a nice surface like a mat or even a bed. You're going to bend your knees with your feet flat on the ground. And what you're going to do, so posterior means backwards and anterior means forward. So in the first top left picture, the gentleman is rotating his pelvis backwards into the ground, right? He's not really clenching his abdominals too hard. He's just relaxing and rotating his pelvis backwards into the ground. And then on the bottom right, he's doing an anterior or forward pelvic tilt, in which he tilts his pelvis forward, bringing his lower back off the mat. Now, you don't have to go full range, just explore this motion of the pelvis. And if you feel a little bit of discomfort or maybe even a little pain, that's normal and that's okay. Your body might just not be used to that movement. But if you're watching this now or whenever you want to try this, give it a shot. Just lay on your back, tilt your pelvis backwards, and then tilt it forward. Just kind of play with this motion. You could do it standing too. It's just easiest in this position. Dan, did I miss anything with this exercise? Any tips you'd like to say?
I guess you can try to engage your transverse abdominis when doing this. That's a pretty large player muscle in the muscle group of your core. So imagine trying to draw or suck your belly button down towards the table as you do this and contract that.
I like that. I like it because like it's not really like clenching your whole belly. It's more of like a suction type thing.
Yeah.
So that's good. Well, we have one person on this now. We will ask Jackie if she has questions in a second, but whoever's watching this, this is our information. If you have questions about this, all the information is right here. There's our phone, our address, our email, our website, our names. All the relevant information is at our website, experiencept.rehab. Take a picture of this for your records, and you can contact us at any time. Okay, so we do have one guest. Jackie, I don't know if you have any questions. If not, that's totally fine. You could, I think she messaged me. She says, no question, thanks. Her microphone is not working. Great job. Well, Jackie, thank you for joining the meeting. We're not really sure where you're from or if you're from the area, but if you know anyone in the Buffalo Grove area who needs physical therapy, come check us out or check out your local physical therapy establishment, wherever you're from. Remember, see it as a preventative measure, physical therapy, not just reactive. Dan, do you have any other final comments for tonight?
No.
Okay, excellent. Yeah, Dan and I like to think we would like to leave before our audience leaves, physically and mentally. We don't want to bore people. We want people to come back to us, not say, oh, those guys are boring, they didn't shut up. Well, on that note, I think we will go ahead and conclude for tonight. Dan, great work, and everyone have a great evening.
Good night.
Good night, everyone.